In this video, I'll be talking about the examination of stains and the proper blood examination. So before that, I think I have to give you a brief introduction here. So the examination of the blood and blood stains is an important part of crime detection. So we need to examine the blood. Why we have to examine the blood? To find out first the nature of the stain, whether it is blood or not. First you have to, if there is any stain in the crime, right, as such that surroundings, you have to find whether that stain is blood or not. Second, we have to find whether the blood is human blood or animal blood. And the third, we have to find the blood groups. But now in this session, let us understand the clear cut concepts of the stains of blood, right? So you can see the stains. Let's say in the surroundings, in the crime area, you have a blood and you have got a seminal stains, right? Let's see how we're gonna see, we're gonna tell those stains are blood stains, right? For that blood stains, you got something known as screening test, right? And you have got other tests known as confirmation test. Under the screening test, we are gonna do some examination, some test, so that we can find out, yes, the stain is blood. The first examination, the first thing, the first test written is, it is Benzidine test. Right, it is Benzidine test. So let me read what's written first. It's written that a dark blue color in presence of blood, most sensitive, or not used because of carcinogen. It causes bladder cancer. So what is he trying to tell here? He's trying to tell us that, so now let me take the stain, say that this is a slide, right, or it has got a stain, or any place which have this has got a stain here. So I have to just see whether this stain is blood or not. So what did I do? And remember one thing, this blood contains hemoglobin, and that hemoglobin, right, the peroxidase action of hemoglobin plays a very important role in this test. The hemoglobin acts as a peroxidase. So what does it do? So when I react this blood with the hemoglobin, right, you can see the blood, on the blood if I put H2O2, and this H2O2 react with this peroxidase activity of the hemoglobin which is present in the blood. That activity converts H2O2 to water and nascent oxygen, right? So we have to understand that this is a benzidine test. We are gonna involve H2O2, right? You have gotten benzidine test. Right now we have got a nascent oxygen here, and this nascent oxygen, right, what does it do? It take electrons from the benzidine, right? It takes electrons from the benzidine and it converts into blue color, right? It converts into blue color. This is what you have to understand. So after mixing of blood, H2O2 and the benzidine test, if you see blue color of the reaction, if you see the reaction, the result blue color, it means that it is because of the peroxidase activity of the hemoglobin which is present in the blood, that's converting the H2O2 into H2O and nascent oxygen, and that nascent oxygen takes electron from the benzidine and it results in blue color. So this is all it is written, that this dark blue color in presence of blood, and this is a most sensitive test, but we are not gonna use because this benzidine, right, so we are not gonna use this actually because it's carcinogen, right? So that is the reason. So that is that is what it's written in our notes. So I have told you that, and this benzidine test is the best screening test for the old strain, right? It is the best screening test for the old strain. So you have to just think that it is a old strain. So old, bold, right? B for Buddha. Buddha means old, for the old strain. So that is how we can remember this. So I think I didn't miss any of the points from the benzidine test. So yes, I didn't miss. So let's go with the next test. So next test written in our notes is phenolphthalein test, right, or Castle-Meyer's test. So what does this phenolphthalein test? This test gives a pink color in presence of blood and the most common test for the screening, right? So now let us understand that how in the presence of the blood this phenolphthalein changes the color, right? So let us understand the concepts here. So let's see that right now. Just remember that this phenolphthalein normally it is colorless. It is colorless when it has got electrons. When it has got electrons, that is reduced form. And this phenolphthalein, when I add with the blood, right? When I add with the blood with phenolphthalein, right? Understand that this blood, right? This heme particle, the hemoglobin which is present in the blood, the heme part, it takes electron from this phenolphthalein, and now the phenolphthalein is oxidized, it has got no electrons. So that is the reason, due to the loss of electrons to the blood, now the change of color is from colorless to the pink. So this is all you have to understand the concepts of phenolphthalein change, right? And the next thing you have to understand that you have got next test, and you have to remember that, and this is most commonly used, right? Most commonly used. So this is what you have to understand the second test. So the next test written in our notes is luminol test, right? What is this luminol test? Suppose if this is a blood stain, right? Say example, this is a blood stain which is present on the wall. I spray this, right? I spray this luminol, I spray luminol on the blood, then it gives blue color, right? It gives blue color, and this blue color, it shines, it brightens, it gives luminescence. So this is what you have to understand, that when I spray the luminol spray on the blood, which is used for washed stains actually, right? If the stains are already washed, for that if you spray on the wall, yet you can see that lightning blue color luminance is seen, so that you can confirm that, yes, you cannot confirm that, yes, you can tell that, yes, this is a blood stain. So this is all you have to understand, which is written in our notes. And next test you have to understand, the next screening test is, right, you got a test known as Gayakam test, right? And this Gayakam test gives blue color when I put it on, right, on blood. So this is all written in our notes regarding the screening tests of the blood stains. So now it's time to understand the concepts of the confirmatory test. How do we confirm, yes, the blood stain is perfectly, that means the stain is perfectly blood, it's not something else. And those confirmatory tests we are divided into two, that is microchemical test, and next we have got spectroscopy. What do you mean by microchemical test? Microchemical test is based on the property of heme part of the hemoglobin to form characteristics color crystals. That means this main concept of this microchemical test is, whenever I mix blood with the stain, some stain I'll be telling now, if I mix the blood with that reagent, right, it forms crystals, and now depending on the colored crystals, we will be confirming, yes, the stain is blood. So let us go with the first test, and that is, what is that test? It is Hemin test, right? Or Techman's test, right? It is Techman Hemin crystal test. So what do you get actually? The moment you get it's written something known as brown rhomboid crystal. So what is it trying to tell actually? So let us know the concept of this Techman test. So what do you mean by Techman test? So when now you got a reagent known as Techman reagent, what that reagent contains, it contains a potassium bromide, it contains potassium chloride, it contains potassium iodide in acetic acid. When I mix this reagent with the blood and I heat it, the heme which is present in the blood reacts with the halides and forms halide. What do you mean by halide? This bromide, chloride, iodide are halides, and this heme particle, hemine, which is present in the blood reacts with this halate which is present in the Tickman's reagent. It forms a brown yellow rhomboid crystal. So once you see the brown yellow rhomboid crystals, then you can confirm it, yes, the stains are perfectly blood stains. Right, so this is all it's written in our notes. So next thing, you have got other test known as hemochromagen test or Takayama test. So what do you mean by Takayama test? In this test you have got something known as pink feathery crystals. So what is it trying to tell actually? It's trying to tell us that, and this Takayama test or hemochromatin test, so what is that? The suspected blood stain on a glass slide. We are gonna take the suspected blood stain on the glass slide. We're gonna heat. We're gonna add pyrimidine in NaOH plus reducing agent. So when you have all these tests like blood, we're gonna heat and pyrimidine in sodium hydroxide. Then we'll be having a reducing agent. So when you heat that, you get a crystals, right? You have got a red feathery crystals of pyrimidine, and these red feathery crystals of pyrimidine is ferroprotoporphyrin, and this is responsible for the red feathery. Suppose if you see the red feathery crystals, you can confirm it, yes, the stains are blood stains, right? And that's all you have to understand regarding this. But in our notes it's a pink to red actually. So let's read what's written only in the notes. Pink feathery crystals. And next we have got something known as the next method of confirmatory test is spectroscopy. What is a spectroscopy? Spectroscopy is the most delicate and reliable test. It is based on the principle that the hemoglobin and its derivatives give characteristics absorption bands when viewed through a spectroscopy. So what is it trying to tell here? He is trying to tell that it is the most delicate and reliable test. What is the principle of this spectroscopy? The principle is that if there is a blood present in the stain, it gives, right, the hemoglobin and the derivatives gives, and that gives an band when you view through spectroscopy. When you view through a spectroscopy, that gives a perfect band. By that you can confirm, yes, the stain is blood stain. So that's all you have to understand. Let's see what's written that. So you can see the spectroscopy blood stain. I can identify the old blood stain also, right? You can identify the whole blood stain here also. And the next thing you have to understand is the most sensitive test, right? It is the most sensitive confirmatory here test. It is the best test for old blood stain, right? So you have to understand that this is the old blood stain. We already spoke about the old stain B for Buddha, that is Benzidine test, right? But this is confirmatory, that was screening, and is the most sensitive test in the confirmatory test. So this is all you have to understand regarding the test. And now let us see the few points which are not written in notes but we have got in MCQs. The few points you have to understand here is, you got, now let's see how do we differentiate to tell whether the blood is from the animal or the human blood. You got an important test known as precipitin test that tells us whether the blood has come from the human or animal. And the next important question written in our MCQs book is, you can see how do you detect the blood group in the blood stain. You got a test known as immunological, right? And this immunological or serological test has, it can be absorption elution test or absorption inhibition test or mixed agglutination test or latex test. And we have got something known as enzymological methods and lattice crust method. And these, right, this lie, L-I-E, lie, L is lattice crust method, I is immunological like absorption elution test, absorption inhibition test or mixed agglutination test or latex test, and E is enzymological method. These are important to detect the blood groups in the blood stain. This is important question which I found in the MCQs. This is all you have to understand, right? In the next session we'll be speaking about the other stain. Let's meet in the next session. Thank you.